Hello, so I'm just going to talk now a little bit about ectopic pregnancy. So unfortunately, ectopic pregnancies, can happen. So people can just be unlucky. I do think that they are much more likely to happen if you have had a history of some sort of an infection or an STD of any kind. So quite often people who may have had a history of chlamydia, there might be some scarring in the fallopian tubes, which then makes an ectopic pregnancy much more likely. So if you have had one ectopic pregnancy, obviously you will have received treatment for it. So sometimes it just dissolves by itself. The pregnancy just terminates and gets reabsorbed by the body. Sometimes you have to take some medication which is toxic to the fetus, which gets rid of it basically, and then it gets reabsorbed. Sometimes you have to have surgery. So if you have had the fallopian tube removed, you don't have to worry about trying to conceive again. It is possible to conceive with only one fallopian tube. So actually the other fallopian tube can reach around sometimes and actually grab the egg from the other ovary, which is quite amazing. So I've had quite a few patients who have had a fallopian tube removed and who have gone on to have successful pregnancies. But if you think that you have had a history of any of chlamydia or something else, some sort of infection, and you've had an ectopic pregnancy, then it's definitely worth going to ask for a scan and to get your fallopian tubes just checked out and to see if there is any blockages or scarring there which might be impeding a successful pregnancy from taking place. So go and get it checked out with your doctor. In terms of Chinese medical terms, it's basically obviously it's a physical reason if there's some scarring in the fallopian tubes, but it can also be qi and blood stagnation. So really we work with the mother preconception. It's all about preconception health. So it's really about making sure that your qi and blood are in good shape before you go into the next pregnancy, and that you've been working hard on your kidney jing. So that's just sort of like, we would talk to you a lot about how to look after your kidneys, how to not overwork, but things that are and have some treatments that supplement the kidney jing, and that will all help as you're going forward for your next when you're trying to conceive again following an ectopic pregnancy.